Welcome back to the deep dive, where we take your curiosity, grab some sources, and really try to give you the full picture.
Yeah, the shortcut to getting informed.
Exactly. And today, we're diving deep into, well, something a lot of you might have thought about, maybe even dreamed about, but perhaps don't fully grasp: dental veneers.
Hmm.
Are they really worth it? I mean, what are they? And what's the whole process actually like? We're going to try and unpack all of that today.
Right. And for this deep dive, we've actually pulled key insights from a pretty thorough YouTube video by a Dr. Nathan Coughlin.
Okay.
Our mission basically is to lay out the essential facts about veneers, guide you through the process, what you need to consider, the realities of it all.
So you can make a genuinely informed choice about your smile.
Exactly.
Okay, let's unpack this then. So veneers, at their core, they're basically this super thin layer, right? Made of porcelain or some kind of composite material.
That's right. Custom designed and then very carefully bonded right onto the front of your teeth.
Think of them like a custom upgrade for your natural teeth, aesthetically speaking.
Yeah, and what's really interesting is just how dramatic that cosmetic change can be. You know, when you see celebrities and they suddenly have this perfect smile,
Yeah, like overnight.
right, it often happens really quick, and it's usually down to crowns or veneers.
Okay.
Now, for porcelain veneers specifically, getting that really precise look usually means taking off a tiny bit of your natural tooth.
How much are we talking?
Oh, minimal. Maybe a millimeter or two of the enamel, depending on the tooth surface.
Hmm.
It's a bit of a trade-off, you see. That small reduction lets the veneer fit perfectly and look amazing, but it also means, well, the process isn't really reversible.
Ah, okay. That's a big point. So we know what they are and that there's some prep involved, a bit of tooth removal, but who's actually a good candidate for these? I mean, most people wanting a better smile probably think about, braces first or maybe whitening.
Exactly, and those are often great places to start. But a good candidate for veneers,
Mm-hmm.
that's usually someone whose teeth are already pretty straight.
Okay.
And maybe they've tried whitening, but they're still not happy.
Yeah.
Often it's because of the tooth shape itself or like a really deep color issue.
Like yellow or gray?
Yeah, yellow or gray or even brown sometimes, and it's just, how the teeth formed. Whitening doesn't touch it.
So if you've done the straightening, done the whitening, and it's still not right because of shape or that stubborn color, veneers might be the next step?
That's a good way to put it.
Okay, that makes sense. But if there are ideal candidates, there must be, well, people who shouldn't get veneers, right? Who's a bad fit? What are the red flags?
Oh, absolutely. And this is super important because getting veneers when you shouldn't can lead to problems or just disappointment.
Right.
So first off, people with a really hard bite or people who grind their teeth a lot, bruxers they're called.
Okay, grinders. Why is that bad?
Well, all that pressure, it can chip, crack, or even pop the veneers right off.
Ouch. Okay. What else?
Also, anyone with active dental problems, like if you've got decay, need fillings, root canals, deep cleanings, anything like that,
You need to fix that first.
absolutely. Veneers are just cosmetic. They don't fix underlying health issues. A good dentist will always tackle health first.
Makes sense.
Then people whose teeth are really, really crooked or like super crowded,
Why is that?
because to make space for the veneer and make it look straight, you might have to remove so much of the natural tooth, way more than that millimeter or two we talked about. And that's just not ideal.
Okay. Any other groups?
Yeah, one more, folks with really bad gum disease, advanced gum disease. It can make the gums recede, and sometimes putting veneers on those teeth can make them look, well, kind of unnaturally long. It affects the whole aesthetic.
Got it. So health first, bite matters, and extreme crowding is an issue. Good to know. Now, as we're figuring this out, you mentioned porcelain and composite. Let's dig into that. There are different types.
That's right. Two main paths here. It's
Yeah.
not one size fits all. The first type, the one you've probably seen the most, that's porcelain veneers.
Right, the common ones.
Yeah, they look amazing. Truly fantastic results are possible. But, like we said, they usually need that little bit of tooth preparation, that slight shaving down.
Okay, that's porcelain. What's the other one?
The other type is composite veneers. These are a little less well-known, maybe not done quite as much.
Why is that?
Well, we'll get to that. But their big advantage, the main appeal, is that often you don't really have to prepare the teeth much or sometimes at all.
Oh, interesting. How does that work?
The dentist basically just kind of applies this tooth-colored material directly onto your teeth and shapes it. It's actually the same sort of stuff they use for clear or white fillings.
Huh. So less invasive sounds good. But you said they're less common. What's the catch? Are there downsides maybe with how they look or how long they last?
Exactly. There are trade-offs. While needing less prep is a big plus for composite, getting a really great natural-looking result takes an extremely talented dentist.
Gotcha.
Like real artistry.
Ah, harder to find someone good for those maybe?
Very hard, yeah. And the other thing is composite veneers. They just don't last as long as porcelain veneers or, say, a crown.
How long are we talking?
It varies,
Mm.
but general less time than the 10, 15 years you might get from porcelain.
Okay, so porcelain looks amazing, lasts longer, but needs prep. Composite is less invasive, but needs a top-tier dentist and doesn't last as long.
You got it. That durability difference, plus the really high aesthetic potential of porcelain, often means porcelain is still the more common choice, even with the prep work.
Right. Okay, so given that veneers, especially porcelain, can look so incredible, it sounds like the actual process, getting them put on, must be pretty involved, more than just a filling, right?
Oh yeah, definitely a bit more intensive to get that really amazing aesthetic result. It's a multi-step journey.
Okay, walk us through it. What's visit one like?
All right, so your first visit, this is all about planning. They'll take x-rays, lots of pictures. You'll have a detailed chat about what you want, your desired outcomes.
Like what look you're going for?
Exactly. And then they take an impression, like a mold, of your mouth.
Okay.
That impression goes off to a dental lab. And the lab uses it to create a model, like a preview, of what your teeth could look like with veneers.
A mock-up.
Sort of, yeah, a diagnostic wax-up or model.
Mm-hmm.
And the great thing is, at this stage, changing things on the model is super easy.
Ah, better than changing your mind after they're glued on.
Way better. You can tweak shapes, lengths, whatever, right there on the model before anything touches your actual teeth.
Smart. Okay, so that's visit one. What happens next? Visit two.
Visit 2 is usually the mock-up review and the preparation phase. You look at that model the lab made, you give your feedback.
Like, that tooth looks a bit pointy, or maybe shorter here.
Precisely. That edge, I think that's too sharp or not sharp enough, or this tooth is too long or short. You fine-tune it. Once you're happy, you give the green light. Then, and only then, the dentist starts preparing your teeth.
So they don't just start drilling on day one.
Absolutely not. A good, careful dentist won't prep anything until you've approved that model. If they want to start prepping on the first visit, that's kind of a red flag. It suggests they aren't being precise or involving you enough.
Good tip. Okay, so after prep, what happens? You leave with filed down teeth?
No. After the prep, they place temporary veneers. These will look pretty good, give you an idea, but they definitely won't look as polished or perfect as the final ones.
Okay, temporaries. Then what? Visit 3.
Visit 3 is usually when the permanent ones come back from the lab.
The real deal.
Yep. They'll try them on first without cementing them. Make sure you absolutely love how they look and feel. Check the color, the fit, everything.
And if you're happy?
Then they'll permanently cement them onto your teeth. And that's it. Well, mostly.
I'm serious.
Yeah, so it's at least 3 visits. Sometimes I might take another visit or 2 if there needs to be more back and forth with the lab to get things just right.
Okay, so it's a process, not instant. Now, once you have these beautiful new veneers, how do you take care of them? Is it different from regular teeth?
Good question. The maintenance is actually very similar to caring for your natural teeth. Regular brushing, flossing, seeing your dentist for checkups and cleanings, all that is still crucial.
So no special treatment needed?
Well, you need to be diligent.
Yeah.
Because here's the thing. Bacteria can still get underneath the edge of the veneer, right where it meets the tooth.
Oh, really?
Yeah. And if that happens, you can get decay under there, which is obviously bad. It could even cause the veneer to loosen or pop off eventually. So hygiene has to be top-notch.
Okay, keep things super clean. What about the grinding thing you mentioned earlier, bruxism?
Yes. Critical point. If you grind or clench your teeth at night, even a little bit, you absolutely need a night guard, a custom-made one from your dentist.
Why is that so important?
Because if you grind, especially grinding forward on those front teeth, you can put huge pressure on the veneers. You could literally pop them off or fracture the porcelain. And then you're looking at potentially redoing the whole thing, which is, expensive. So for grinders, getting a night guard is just, it's a no-brainer. It protects your investment.
Like insurance for your smile.
Pretty much, yeah. And one other really important thing to remember, veneers are definitely not permanent.
Right, you mentioned that. How long do they typically last?
On average, you're probably looking at replacing them every, say, 10 to 15 years. Sometimes longer, sometimes less, but they will need replacing eventually.
Okay, 10, 15 years, need great hygiene, and a night guard if you grind. Got it. Now let's talk practicalities, numbers. How many veneers do people usually get? Is it just the front two? And the big question, how much does this all cost?
Okay, yeah, good
Eh,
questions. The number of veneers, that's actually a very personal decision. It really depends on your smile line.
How many teeth show when you smile?
Exactly. Some people might only show maybe their front 4 teeth when they have a big smile, but most people, they show at least the front 6, often the front 8 teeth on the top.
8.
Yeah. And the key thing is getting a result that looks natural and cohesive. You don't really want just like 2 super white, perfect teeth and then have the ones next to them look totally different in color or shape.
Right, that would look kind of weird.
It wouldn't look good now. So you usually need to do enough teeth, whether it's 6 or 8, sometimes even 10 on top, to create that really nice, beautiful blended smile.
Okay, so likely 6 or 8 on top. Now, the cost. Brace ourselves.
Yeah, veneers aren't cheap. That's the bottom line because they're considered cosmetic.
Insurance doesn't usually cover them.
Insurance covers about that much of it. Basically nothing.
Ah.
They don't cover anything cosmetic. So
Okay.
pretty much all out of pocket for you.
Okay, ballpark figure per tooth.
You should probably expect, on average, around $1,000 per veneer. Maybe a bit more, maybe a bit less, depending on where you live and the dentist. But that's a reasonable average.
1,000 per tooth. So if you get 8.
You're looking at a significant investment, yeah. Now, usually if you're doing multiple veneers, like 6 or 8, most dentists will offer some kind of discount, a package deal.
Okay, that helps a bit.
And there are financing options too. Things like Care Credit, which is like a healthcare credit card, can help people manage the cost over time.
Right. Okay, so a major investment, likely out of pocket, good to know up front. So let's try and wrap this all up. We've covered a lot. From your perspective, summarizing everything, what are the main pros and cons someone should really weigh up?
Okay, yeah, let's boil it down. This is really where you need to do your own personal calculation, right?
Mm-hmm.
So the pros. First, they can look amazing. Truly transform your smile into that bright, beautiful smile many people want.
Big pro.
Huge pro. Second, you get to choose the shade. So if you have those really yellow or gray teeth that resist whitening, veneers can completely change that. Third, they can last a while. That 10-15 year lifespan is pretty good. And finally, the actual procedure itself, while multi-step, is generally pretty comfortable, pretty easy for the patient overall.
All right, those are some strong positives. Now, the downsides, the cons.
Okay, cons. Number one, as we stressed, they are not permanent. You will have to replace them probably every 10 to 15 years. That's an ongoing cost and process.
Right, long-term commitment.
Exactly. Second, they're pretty expensive and insurance likely won't help, so it's a big financial decision.
Okay.
Third, you absolutely need to maintain your oral health, like perfectly. Flawless hygiene is key to prevent problems underneath them.
High stakes for brushing and flossing.
Very high. And lastly, if you're a grinder and you don't manage it with a night guard, you risk damaging them, popping them off, and that just means more costs and more hassle.
Got it. Not permanent, expensive, needs perfect hygiene, and risk if you grind.
Those are the main things, yeah. You really have to weigh them out yourself, see if it fits your goals, your lifestyle, your budget, and your commitment level.
And there you have it. Hopefully this deep dive has given you pretty much everything you need to know about dental veneers.
Yeah, the cost, the procedure,
Yeah.
the pros and cons.
And crucially, whether you might actually be a good candidate for them in the first place.
Absolutely. And maybe just a final thought to leave you with.
Oh.
As you think about aesthetic procedures like veneers, and you understand the commitment involved, financially, the time, the ongoing care, how might that influence your perspective on other proactive health investments, things you do for your long-term well-being?
Interesting angle. Definitely something to think about, the value we place on different kinds of health investments. Great thought.
Just something to consider.
Well, thank you for joining us on this deep dive. Keep exploring, keep asking questions, and we'll catch you on the next one.